some advantages of performing this test. Of course, as we mentioned, it's a diagnostic tool that confirms your diagnosis and your objective test. It's the only objective test that's limiting any kind of false subjective findings. So it's a great tool to have. It's predictive. If it's performed right, you're going to have great results every time. You're not going to have false negatives. And it's really a baseline to where you're starting to your therapy, and you can really monitor your therapy. So as I mentioned, you can follow up with patients 6 months to a year. They don't always need a repeat test because you can really kind of go with how they're feeling, their symptoms. But if you see that you're not having the improvement that you want, you can always go back and redo the test in a 6-month period and really see if your treatment is actually changing the results, the number of nerve endings that are showing up on the path report. So it's great to have that, something to be able to compare and really kind of discuss with the patient. And maybe if they're getting discouraged that, hey, nothing is happening, you can redo this test and really show them that, hey, actually there is a change in your test results and what we're doing is working. Maybe it's just not working as fast. So it's really fantastic to be able to do that and have that baseline to kind of start from. As we mentioned, highly specific, highly sensitive for assessing small fiber neuropathy. It's an in-office procedure. It takes less than 5 minutes to do per site, given that you have everything ready, which we'll go over here shortly. So, it's not a big production. You don't have to set an hour away to just do a biopsy. Patients are in and out in the regular established appointment setting. And as long as you've planned ahead, you have a protocol, you're able to do it right then and there when they're there and have your results within 2 weeks and start their treatment. It's a very easy test to perform for the physician, and patients, they have no downtime. They can immediately return to work. They can go back to their physical activity. They don't have any pain or limitation. They have a small dressing Band-Aid on the biopsy site. So that's another great thing that patients love. There's no downtime for it. It is a test that's covered by Medicare and private insurances. It's your average skin biopsy code. So it's not any kind of special code that you're using. The CPT codes that we use are 11104 for the first biopsy site. And if you're doing bilateral testing, which I always advise, then for the second site, you're doing that 11105. So again, you want to look at, of course, patients' deductibles, out of pocket, all of that. But the question is always, hey, does insurance cover this? And the answer is yes. And it's your typical skin biopsy codes that we're using. Of course, you want to have proper documentation. Depending on pathology lab that you work with, a lot of them have consents on their websites that you can print off in English and Spanish, of why this test is being done, what's going to happen. So you want to have that consent in the patient's chart, and why this test is necessary in your notes. So of course, those documentation materials are necessary to be able to get this covered in case they request any kind of a documentation. But having a consent and proper diagnosis and why we're doing this test should be adequate for you to get the test covered by insurance.